Hi, Calvin.
Hi.
Hi, my name is Mariah. I'm a physician assistant student. I'm going to be taking some history questions from you today.
Nice to meet you.
Nice to meet you. All right. Is it okay if I call you Calvin?
Sure. Yeah,
Okay.
absolutely.
Awesome. And can you tell me your date of birth really quick?
Sure. It's 1963, August 14th.
Okay. Thank you. All right. Tell me what brings you in today, Calvin.
So I've been having this right knee pain
Okay.
for a good 4 or 5 days.
Hmm.
And it's really stiff.
Okay. All right. So right knee pain. All right. So you noticed it about 4 to 5 days ago? Did you notice that you were doing anything that maybe caused it? Was there a certain event leading up to it?
I mean, like, I guess like a week ago, I was helping someone like move out of his apartment.
Okay.
And I may have like banged it into what's that called at the end of the stair? The banister.
Oh, yeah. Okay. So were you moving like heavy furniture and stuff? Or
Yeah.
Yeah. Okay.
Surprised my back doesn't hurt, to be honest.
Yeah. And then did you feel the pain like right when you hit it and then did it go away? Or have you been having this constant pain? Or it didn't hurt when you hit it?
It didn't hurt when I hit it.
Okay.
I mean, like, it kind of like, it hurt for a second and then kind of went away and didn't really think about it since then. And then like a couple days after that, it started getting really stiff.
Okay.
And it's been kind of getting more and more stiff. And then since yesterday, it actually has been hurting quite a bit.
Okay.
So I guess the pain started about 2 days ago.
Okay. So then when you're saying it's stiff, is it like harder to bend and move than it usually is?
Yeah, I feel like it doesn't really want to go anywhere. Like if I have it, like this, then it's hard to sort of stretch it out without a lot of pain.
Okay. Does it hurt to the touch, or is it more like inside?
Mm-hmm. It hurts. It hurts when you touch it. Yeah.
Okay. Could you use your finger and like point to the area?
Sure.
Or
It's like it's almost like it's like all under my kneecap where the two bones match up for my leg.
okay.
They're all in that area.
Okay.
It feels like someone just pulled a whole bunch of stuff in there and there's no room for anything to go.
Okay. Does it feel like there's any like fluid or sloshing or?
I don't know about sloshing, but it definitely feels like it's like someone injected it with something. If that makes any sense, I don't know. That's the best way I can describe it. It's also like it feels like you can see it's red and it's a little warm.
Okay. Have you tried doing anything to make this pain better within the past few days?
Yeah, I've tried. Nothing works.
Yeah, what have you tried?
I've tried ibuprofen, ice. Ice helps a little bit actually, but it doesn't completely get. It makes the stiffness worse, but the pain better. So it's a catch-22.
So it helps a little with pain, but makes it stiff. Have you done anything that makes it feel worse?
Moving it.
Okay.
Putting any weight on it.
Have you had any pain like this previously in the past?
No.
Okay. And then do you feel like the pain has stayed like the same over the past few days, or has it gotten worse, more severe?
I guess the pain started yesterday, and it's gotten worse since yesterday.
Okay.
It's from a 4 to a 7 out of 10.
Okay. Okay. And you said it feels stiff, but does the pain feel like, is there any sharp shooting pain? Is it kind of dull? Is there any other words you could use to describe it?
I'd say it's like dull, but it's like pressure.
Okay.
So I wouldn't say it's like shooting pain, but it's like, it's very strong pressure.
Okay.
If that makes any sense.
Does it hurt more when you're standing and you're putting weight on it?
Yeah.
So other than it being warm and red, have you noticed any other symptoms accompanying that?
I guess it's almost like it kind of moves to the leg above it, like in the muscle and that area right here.
Okay. The pain is
Yeah,
moving?
the pain.
Okay.
Yeah. But other than that, nothing comes to mind.
Okay. And then you mentioned taking ibuprofen to try and make it any better. Do you recall the dosage of how much ibuprofen you took?
I think I took 3 or 4 tablets, 200 milligram.
Did that bring you any relief or no?
No.
Okay. Are you on any other medications?
No.
Okay. Do you take any multivitamins or natural substances?
I take 1 a day meds.
Okay. And is that orally?
Mm-hmm. Yeah. Every day with breakfast.
Okay. Do you have any allergies?
Just seasonal.
Seasonal? Okay.
Yep. So, pollen, grass.
Yep, all the good stuff, right? And then what kind of symptoms do you experience with your seasonal?
Just runny nose and sneezing, itchy eyes. Sometimes I'll get like a cough, like when the seasons change. Either like when spring starts and when fall starts, it's pretty much like clockwork. I'll get sort of congestion in my throat and in my sinuses.
Oh, okay. So congestion and cough too. Do you usually take anything for that to try and relieve those symptoms?
Allegra.
Okay. Alrighty. And then, do you have any specific allergies to latex?
No.
How about iodine?
No.
No? Okay. All right. And then when did you notice those seasonal allergies? Did that develop as a child? Or?
Yeah.
Okay.
Since I was a kid.
Alrighty. All right, so I'm just going to go through some of your past medical history just to see if there are any links. So as a child, how would you describe your general health during your childhood?
I'd say it was pretty good.
Okay.
I didn't really do a whole lot, so I stayed out of trouble.
Okay, good.
Yeah.
Okay. And then, did you have any illnesses as a kid?
Just the allergies.
Just the allergies, okay. I'm just going to ask you a few specific ones just to see if I can jog your memory with anything. Have you ever had measles?
No.
Mumps?
No.
Chicken pox?
Yeah, I had that as a kid. Probably
You did?
3 or 4 years old.
Okay. And then, did you have the classic, like, pox, like, on your skin?
All over me.
Okay.
Yep.
And then, how did you get treated for that?
Chicken soup.
Okay.
All the rest.
Do you recall ever getting a vaccine for that after you got it the first time?
I don't think so. I think when we went to the doctor, they said that I was okay. I'd be immune for life.
Okay.
And so far, he's been right.
All right, good. Have you ever had rubella?
German measles?
Yes.
I don't think so.
Okay. Rheumatic fever?
No.
Scarlet fever?
Nope.
Polio?
Nope.
Have you ever had any psychiatric disorders diagnosed?
Nope.
Okay. And then, so we said no about the chickenpox vaccine as a child. Did you ever get it as an adult?
Mm-mm.
Okay. Have you ever been vaccinated for polio?
Yes.
Okay.
That was when I was a kid, I guess.
Okay.
I can't remember. It was younger than 10.
Right. Okay. Yeah, some of these are really hard to remember because you're diagnosed when you're younger,
Right,
and then
right,
obviously you forget over time. So how about MMR for the measles, mumps, and rubella?
I think I got that like as a young adult.
Okay.
can't remember the year.
It's okay. We'll just look into some past medical records to try and get those dates if we need them then.
Yeah, they're in a vault somewhere.
Okay.
Sure.
We'll try and find them.
Okay.
How about tetanus?
Tetanus. Yeah, the last one was 3 years ago.
Okay. How about diphtheria?
Yeah, I think that was at the same time.
The same time as the tetanus?
Yeah.
About 3 years ago. Okay. How about pertussis?
Years ago. I can't remember the last one.
Okay. Hepatitis B?
I think I've had that. Yeah, I think I've had the series for that.
Okay. Pneumococcal?
No.
No? Okay. And how about the flu vaccine?
Every year.
Every year? Very good.
I've had the flu before, and I really don't want it again.
Yeah, it's not fun. It's
Yeah.
not fun. All right, so now I'm going to try and move on to your adult health. Have you had any illnesses or diagnoses within your adult life?
No.
Nothing that you can recall?
Nothing that I can remember now.
Okay.
I'm pretty healthy. I just try to stay active.
Good. That's awesome.
Yeah.
Again, I'm just kind of going to go through a list,
That's fine.
see if I can jog your memory for anything.
Sure.
Have you ever been diagnosed with hypertension?
No.
Diabetes?
No.
Tuberculosis?
No.
Heart disease?
No.
Lung disease?
Asthma.
Asthma? Okay. Do you remember when you were diagnosed with that?
As a young adult, I think.
Do you have any specific treatments for that?
I think it was sort of like a phase that I went through, if that makes any sense.
Okay.
And they gave me, they put me on like a nebulizer a few
Okay.
times, but I haven't had issues with that for years.
Okay. Have you ever used an inhaler before?
Yeah, they gave me an inhaler too,
Inhaler.
just in case.
Okay. Do you by chance recall the last time you used that, or that just hasn't been relevant recently?
More than 10 years. I
Okay.
guess.
Alrighty. And then how about kidney disease?
Kidneys are fine, yeah.
Okay, good. How about thyroid disease?
Mm-mm.
HIV?
Nope.
Seizures?
Nope.
Cancer?
Nope.
Hepatitis?
Nope.
Right. Have you had any surgeries before?
No.
No surgeries?
Thankfully, I haven't needed.
Okay, good. I'm also going to ask you just about some screening tests
Sure.
to see if you've had those. Have you ever been screened for tuberculosis? That's when they usually inject some fluid and a little bubble pops up on your skin, and then you go back a few days later and they see if it goes away.
I think I'd remember that, and I don't think I remember that.
Okay. Alrighty. Have you ever had a lung cancer screening?
I don't think so.
Okay. How about cholesterol tests?
Yeah, I bet it's been a few years. I think they were normal.
Okay. I'm sorry, I'm going to backtrack a little bit. I
Sure.
forgot something. Sorry about that.
That's okay.
Can I just quick ask your age?
Sure. It's 56.
Okay. And then what gender do you identify as?
A male.
Okay. And then what ethnicity are you?
I'm white.
Okay. And what's your occupation?
I work construction.
What's your marital status?
I'm single.
Okay. And then how's your general health, would you say?
I'd say generally it's fine.
Okay.
Yeah.
All right. Sorry about that. I realized when I got to the screening that I forgot to ask some of those questions.
Yeah, it's okay. You remembered.
So then, have you ever been screened for a colonoscopy?
No.
No. Okay.
I've been avoiding that though.
Yeah. That's okay. We'll figure out when you should be expecting that, and then we'll prepare for it to help you get
Okay.
through it.
Sounds good.
Have you ever had a prostate exam?
Nope. Been avoiding that too.
Okay. Again, we'll make sure that we check in with that. And then, other than that, have you had any hospitalizations in your adult life?
No.
No? Okay. And then this is also another part of the history that we make sure we ask all of our patients because it's important to your physical health as well.
Yeah.
But have you had any contact with psychiatric services in the past?
No.
No? Okay. All right. And have you ever tried hurting yourself?
No, not intentionally. I'm pretty clumsy, so
Okay.
I don't think that counts.
All right. All right. Yeah, we just want to make sure, just to ensure the safety of our patients, make
Sure,
sure
yeah.
everyone's well-being is good. And so I'm going to move on to some family history. Do you recall any illnesses your paternal grandfather may have?
Maybe high blood pressure.
Okay.
Yeah, I think he had high blood pressure.
Okay. Is he still alive?
No, he passed away in his 90s.
Okay. Okay. And how about your paternal grandmother?
She died in her 90s as well.
Okay.
I think she had a heart problem.
Oh, okay. Do you know if that's what she passed away from?
I think so.
Okay. Do you remember if that was something that was kind of ongoing, or was it something really sudden with her heart that caused the problem?
It was ongoing towards the end of her life.
Okay. Okay, thank you for sharing that with me. How about your maternal grandfather?
He passed in his 70s.
Do you know what from?
Car accident.
Oh, I'm sorry to hear that.
Thank you.
Did he have any significant health problems? No? Okay. And then what about your mom's mom?
She passed in her 50s. Ovarian cancer. I never met her.
Okay, and then what about the health for your mother? Has she been screened for cancer or anything like that?
Yeah, she gets a screening every few years for that.
Okay.
But she's fine.
Okay. She doesn't have any like high blood pressure, cholesterol?
She's been pretty good, yeah.
No? Okay. And she's still living?
Mhm.
Yes, okay.
She's in her 70s.
And then what about the health of your father?
He's all right. He's 81.
Okay.
He's got some high blood pressure issues.
Okay.
Other than that, he's fine.
Okay. And then just because of your dad's dad and your dad, do you keep an eye on any hypertension issues that may be seen within your health? Do you watch?
No, I probably should, but I don't.
Okay. That's all right. We'll try to keep an eye on that. We'll make sure to take your blood pressure every time
Thank
you come in. Yep. And then we can also give you some information on like some exercising and dietary habits just to make sure that we try and keep your blood pressure controlled if it were to ever get to something like that.
Okay, thank you.
Mm-hmm. Do you have any siblings?
No, I'm an only child.
Okay. And then have you ever had any children?
No children.
All right. I'm going to move on to some more like social history kind of questions, if you wouldn't mind sharing with me.
Sure.
Do you smoke?
Not anymore.
Okay. When did you quit?
Like 25 years ago.
That's awesome. Good for you.
Yeah.
I know that can be hard, but that's awesome. So how long did you smoke before you quit?
Probably like 15 years or so.
Okay.
That's a pack a day.
Okay. All right. Well, that's awesome you quit. I love to
Yeah.
hear that. That's awesome. Do you drink alcohol?
Yeah, not all that often, but yeah, I do.
Okay. About how often would you say?
3 nights a week.
Okay. And about how much?
1 or 2 beers.
Okay. Alrighty. And then have you ever experienced any illicit drug use?
Yeah, way back when.
Okay.
I mean, I smoked weed, but like everyone did, you know.
And at what age was that?
Teenage, college years, I guess.
Okay. So has that followed you into your adult life at all?
No, I mean, honestly, you know, some of my friends kept going with it, but it just got kind of boring for me. Like,
Okay.
felt like it was time to grow up.
Okay. Alrighty. Now, this is also something that we ask all of our patients, but if you feel uncomfortable, we can definitely skip some questions or stop if you would like. But I'm going to move on to the sexual history, if that's okay.
Sure.
Are you currently sexually active?
No.
Okay. Have you ever been?
No.
Alrighty. Okay. And then are you comfortable with that? Are you comfortable with your sexual health?
Yeah.
Okay. Alrighty. And now some more social history questions. Where were you born?
I was born in Pittsburgh.
Okay. That's an awesome city.
There's a lot going on up there, that's for sure.
Yeah, I love it. And then how would you describe your childhood, besides your childhood health?
I'd say it was pretty good. Yeah, I mean.
Okay. All right. And then what was the last year of schooling you completed?
I did like 1 year of college, and then I realized that I wasn't really that interested in academic.
Okay.
So that's how I found myself in construction.
Okay. Did you end up going to trade school for that, or just something that you got into afterwards?
No, it was a lot of on-the-job learning, actually.
Okay. That's
Yeah.
cool. Do you enjoy it?
I do. Been
Good.
doing that for a long time.
Okay. And that's something you're still doing currently?
Yeah.
Okay. Very cool. Have you had any military experience?
No.
Okay. And I know this is also a very personal question, but how do you feel about your financial situation? Do you feel pretty stable, or?
I mean, I'm stable. I'm not, I'm not poor. I'm not rich, but I'm pretty simple.
Okay. Thank you for sharing that.
Of course.
What are some hobbies that you like?
I like to do a little bit of carpentry work.
Okay.
I like to go hunting.
Cool. Carpentry. All right. And then what is your living situation like?
I live in a house
Okay, by yourself?
by myself, yeah.
Okay.
And my dog,
What kind of dog do you have?
German Shepherd.
Oh, okay. That's awesome. Okay. This can also be a sensitive question, but it is important that we ask. Does anyone in your life, do you feel like anyone disrespects you or physically hurts you at all?
No, I don't let him.
Okay. Can you elaborate on that? Do people try to? Or?
No one at home. I have a pretty high up position at work, so
Okay.
there's always going to be some tension, I guess, with employees.
Right.
But I mean, I think that I'm a pretty good communicator, so
Mhm.
I don't. I think that as long as you're respectful and open to people around you, typically, they kind of follow suit for that.
Right. Okay.
Yeah.
Okay, well, if you feel like that situation ever gets dangerous or anything, you can always come talk to us because this is a safe space here.
Thank you.
But that's awesome that you look at being like open and respectful.
Yeah.
That's really good. And then, do you drive yourself?
Crazy? Yes. All the time.
And in a car?
Yeah.
Okay.
Yeah, I'm still driving.
Okay. And then, do you bathe yourself?
Yes.
Do you dress yourself?
Yeah.
Do you feed yourself?
Oh, yeah.
Okay. Are you able to go to the bathroom by yourself?
Yes.
Yep. And then, do you have any specific religious beliefs?
Roman Catholic.
Okay. And then, do you exercise?
Yeah. I get a lot of exercise on the job.
Okay.
A lot of lifting.
Alrighty. So then, has this pain in your knee impaired your ability to work at all?
Yeah.
It has?
I'd say, yeah.
Okay.
It's hard to put any kind of weight on it, so it's hard to do my job, really.
Okay.
That's part of the reason why I came in.
Yeah. All right. Sorry to hear that. Hopefully we can get that fixed up for you then.
Okay. Yeah, I hope so.
Why did this go black? Is it still recording? I hope so. Please.